as long as possible. The life expectancy is getting longer and longer. Patients want to have a good quality of life, so enjoy the life and have minimal risk of for bleeding. So we try to have always a curative treatment choice. So just and the best way would be one operation for the whole of the life. So I think it's a very important factor. So if you have more development of your prosthesis, so you're getting better hemodynamic performance of the prosthesis on the first hand, and on the other hand also a longer longevity of your prosthesis. So it would be the best choice for the patients. So as you see, some risking the life. Well, actually risking the life. Symptoms like congestive heart failure, left myocardial hypertrophy, and getting less and less activity because of your congestive heart failure. So all problems where if you do also the operation after aortic valve replacement, you cannot get all these problems reversible. So this is a problem. So I think there are many different opinions of referral colleagues who do see all these patients, but they try to move the time of the operation as late as possible, and I think it's a very big problem. My first case was a younger patient, I think 22 years old. He was playing handball and was very active in sport life. So in this case, he had a bicuspid aortic valve and stenotic aortic valve. So in this case, to implant a mechanical valve, it's not good. So it's we try to in this case implant Resilia, and based on my experience, it is not it's not a completely new valve. It is a upgrading of Perimount Magna Ease. So you see this as the same stent and the same design. So for my surgical experience, it's upgrading of the leaflets and also using another anti-calcification treatment on this valve. So we had this paper with experimental investigation of the longevity of the valve. So this is a very respectful group in Belgium who did this papers, and the procedure was done through mini thoracotomy and with 3D camera, and it was very fine. The patient was stable. There was no problem with transvalvular or perivalvular leakage and no relevant gradient. So patients now now active again and playing handball, and there's no problem with that. So he's happy, we are happy. So also in other cases, I think we have done this. We have implanted about 50 or 60 cases of Resilia. So if you look at our experience in the last 5 years, so the normal age for a replacement of the valve is about 65. So in these patients, we try to use a biological valve. So if you go 10 years younger or younger patients, so based on guidelines, they recommend using a mechanical valve. There is a significant trend to go for more biological valve. You treat these patients, you give quality of life, and they can work, they can have their life, so just enjoying the life. The surgery should help the patient to live more long and without any complications. So this is would be for me as a good success. I think to reduce the traumatic of my operation, if you reduce the traumatic of your surgical procedure, if you implant a very high quality prosthesis, and you can avoid a reoperation for the next 10, 15 years with the same quality of life, I think this would be a success. I hope the life expectancy is getting longer and longer. Patients want to have a good quality of life, so enjoy the life and have minimal risk of for bleeding. So we try to have always a curative treatment choice. So just and the best way would be one operation for the whole of the life. So.